Today's Ask the Doctor segment is all about afibrillation, and Dr. Sahli Attawala with Princeton Baptist Medical Center is here to answer your questions. If you'd like to ask a question, give us a call right now at 741-9272. Doc, let's just start out. We hear the term AFib all the time, but let's be sure we all know what we're talking about. What is it?
So AFib is a really common heart rhythm problem. It's actually the most common heart rhythm problem that we see. It's a fast and irregular heart rhythm that starts from the top part of the heart. And normally people have a variety of symptoms related to it. They can feel a heart racing. Sometimes people feel out of breath when they go into it. Some people can feel pains in the chest. AFib in and of itself is not a life-threatening heart rhythm, or it's not dangerous. What's dangerous about it is it does put you at a significantly higher risk of having a stroke. And that's the part that we try to deal with is, how do we reduce the risk of stroke? That can be with blood thinners depending on your other risk factors. And then the other side of it is controlling the rhythm itself.
And so give us an idea, what's the sensation you feel if you're having an AFib problem that you need to have checked out?
So it totally depends from patient to patient. Some people will feel a flip-flopping in their chest when their heart goes out of rhythm. They'll feel that their heart is racing more so than it should be. For whatever reason, some people don't feel anything related to their heart rhythm, but what they'll feel is a decrease in the amount of activities that they can do. So for example, when someone is in AFib, they won't really notice the heart racing, but all of a sudden they realize that they're getting really out of breath going up a flight of stairs.
Okay.
And then, that might not be related to anything with their lungs or their, any blockages or anything, but it might be that because they go into AFib and their heart isn't able to keep up when that happens.
So I know mitral valve is something you feel kind of a flutter. Would it be similar to that, or how do you know?
Yeah.
One's
No, that's a good point. So mitral valve problems can predispose you to developing atrial fibrillation. There's a lot of different things that put you at risk for having AFib. One of the ones that's under-recognized is the risk of developing atrial fibrillation with obesity. That's something that we're learning more and more about as we learn more about this disease. As you gain more weight, you're also not only at a high risk for developing blockages in heart arteries, but also for developing atrial fibrillation.
Okay. We have our first caller. Let's listen to Debbie. Debbie, what is your question?
Yes. I've not been diagnosed with AFib, but I have the heart palpitations, and I have been on beta blockers. That's not working for me, and I have what they call the extra heartbeats also. And I was just wondering what the doctor thought about having the ablation done for that.
Yeah, that's a really good question. So ablation is something that I specialize in. So I'm a cardiac electrophysiologist, and our specialty is treating a variety of heart rhythm disorders. And one of the tools that we have in our armamentarium to treat that is with an ablation, when we put catheters in through the groin, go up to the heart, find where the heart rhythm abnormality is coming from, and then ablation involves applying heat or freezing to that area to take care of the rhythm problem. Now, as far as you're concerned, there's lots of different heart rhythm problems that can cause palpitations. It's hard to sort of just go in to do an ablation without actually knowing exactly what that heart rhythm problem is. So a lot of times what we'll do is put a monitor on, and we have a variety of length of different monitors that we can do. We can do a monitor for 24 hours, 48 hours, or a month, and then we also have implantable monitors that can be good for almost 3 years if doctors are having a difficulty diagnosing what your palpitations are coming from.
Okay. Very quickly, we have one more caller if we can answer it quickly. Betty, what is your question?
Oh, I wanted to know, my problem is I wake up at night and my hands and my arms are asleep. And I just have to move them and shake them and shake them, shake them. And finally that tingling goes away. And I just wondered if it had something to do with my heart.
That's hard to answer. It would be unlikely that a rhythm problem would be causing those kinds of symptoms. You know, it seems like it's more of a non-heart rhythm related problem, but definitely something that seems like it's you know, talking to your doctor about to see if they can give you a better answer.
Okay. If you have a question about anything, talk to your doctor. Dr. Attawala, thanks for being with us. We appreciate it.
Absolutely.
We'll be back in just a moment.